Hi, everyone. Welcome to our November 2023 Ask the Expert interview. Today, I have a very familiar face with me. I have Pat Ryan with the Bluegrass Lions Diabetes Project. So thank you, Pat, for being with me again this November as we are in Diabetic Eye Disease Awareness Month. So thank you, Pat.
Well, thank you, Jennifer. Always a good time to be with you and get to talk about our Bluegrass Lions Diabetes Project, and especially when discussing things too, how it affects vision. So yeah, we have a lot in common trying to get diabetes under control to help people's health and stop the risk of all kinds of bad things happening to them.
Yeah, and so you just touched on this, but people with diabetes are more likely to develop blinding eye diseases, such as diabetic retinopathy. And so just kind of give us the brief background of why you started this project.
Well, my story goes back when I was about 7, 8 years old. My grandmother came to live with us, and she's a big woman. She was the first policewoman in Evansville, Indiana. But I found out that she had pretty good sized feet, but she wore a size 10 on her right foot, but just a size 8 on her left foot because all of her toes had been chopped off that left foot, all due to diabetes. She had heart disease and stuff, with diabetes being the main component of that. Had another uncle who had his lower left leg chopped off because of diabetes. So it's been in my family. I got diagnosed in the year 2000. After I became a Lion, I went to the 100th Lions Club International Convention in Chicago, and that's when they took on diabetes as a main project. And I just sort of jumped all over it. Says, what can I do? How are we going to get to going here? How are we going to stop this diabetes stuff? They had to hold off till they got things more in order, and it was about a little over a year later. They finally had an application ready. They sent it to me, and there's a number of things you could do with that, but I decided I'd like to try to go out and find people that have diabetes and don't know it, and educate everybody about the risks of having diabetes. And so we started our BLDP, our Bluegrass Lions Diabetes Project, to perform A1C screenings on people. The A1C screening is a simple blood sample, a little finger stick, 5 microliters of blood is all we need. And in 5 minutes, you basically get a A1C score, and you can see your risks of diabetes. And the good thing about the A1C test is that it doesn't make any difference what you just have to eat or drink. You don't have to fast. You don't have to call your doctor up, get an appointment, go sit in the waiting room, go back, wait around, go down, get labs, and next day or so, get your results. Boom, we give it to you in about 5 minutes. And we do emphasize, though, these are screenings and not diagnoses. If the levels are high, we strongly encourage folks to go see your doctor, see about a diagnosis. But we'd like to get out and get as many people screened as possible. And right now we've kind of checked my numbers. It looks like 2,978 screenings. And of that amount, 39% had elevated scores. Now, we also started keeping track of those that had been previously diagnosed with either prediabetes or diabetes. And that's a fairly good number there, about I'd say it's about 15%. But then again, it's not uncommon at all that even though they have diabetes and should be trying to control their diabetes, they quite often see that their scores are much higher than what they thought they should be. So we're out there just to educate people and let them know the risk of diabetes.
Yeah. And so I know that COVID has put us all who are out doing any kind of screenings behind. We weren't able to do as many back then when things were shut down. But things have opened up a little bit more in the past year. And you told me before we started talking, but how many events have you all done kind of post-COVID, and how do you feel it's going?
I went back and just quickly got a ballpark figure from like January of 22. We've performed 70 some odd events, 70 some odd screening events, and we've done 150 altogether. Excuse me, 170 altogether.
So that's good. Sounds like things are starting to pick up and doing more and more events now. So what are you currently doing in the community, or what events do you typically like to go to?
We will go about any place some people want us to come and get a group of people together to be screened. Health fairs are some of the more popular type of places. But we were just recently in Louisville at the United Auto Workers, Retired Auto Workers Union annual meeting. And we did 38, I believe it was 37 screenings there. Probably about the third year we've done this. But November is Diabetes Month, World Diabetes Month, and November the 14th this year was World Diabetes Day, and we were up in Covington then. At the St. Elizabeth Life Learning Center, we did a thing for some Fork Bank employees, a health fair there with them. We were at the Lexington North YMCA for an AARP health event thing. I had a big one up in Louisville back on October 7th at the Redeemer Lutheran Church. They have an annual health screening kind of event, plus they do a lot of other things. And that really turned out to be nice, very well organized. We've been all over the place. Looking at other locations in Frankfort, Hopkinsville, or Lexington, Moorhead, Lexington's, Covington's, Owensboro. So we get out all over the state. Again, if people want to be able to use our services to screen their community for A1C, we'd be glad to go. We'll try to work it out and get some volunteers there to do the screening and let everybody know the results.
Sounds good. What results are you typically finding from these screenings? I know you mentioned that there were between, I think it was 35 or 40% that were high levels of A1C, and then there were a portion of those who kind of already had been pre-diagnosed or had pre-diabetes and they knew about it. But is that typical among other states, or do you know, or are we pretty high in these numbers?
We're a little bit higher than most all other states. I think West Virginia might be worse off than we are, especially in the mountain areas for both states. Just a matter of education and lifestyle. When we discuss diabetes, we always mention diabetes is a chronic disease. Once you have it, you got it. You don't get rid of it. You can't take a shot or take a pill and then it's gone. Not like other infirmities, ailments. But you can manage it. That's the good news. The older we get and the bigger we get, the more those A1C scores tend to rise. And the higher they get, the more damage gets done inside the body. The higher the score and the longer it stays high, the more damage gets done. So we try to help people say, here's how you can manage diabetes, how you can get those A1C scores back down more towards a normal range. And the two main things, healthy eating, good dietary habits. We tell folks there's no bad foods. You don't have to give up anything. It's just how much you eat of it and how often you eat it. You don't have to sit down and eat the whole bag of chips. You can take just a handful, and that will satisfy your salty cravings. pumpkin pie time coming up. You don't have to eat the whole pie. Don't have to go back for seconds. And you might want to just take a half a piece of pie. That will satisfy your pumpkin pie cravings, and you move on from there. And just portion control, common sense. Again, don't have to give up anything, but you do need to watch how much you eat of it, how often you eat of it. And there's some foods you might want to eat just occasionally. And look for non-fatty meats. I mean, turkey time's coming up, and that's good. Just try to stay away from a whole bunch of that extra gravy, and most of the turkey fat's in the skin. You might want to shy away from that a little bit. And sweet potatoes are a really good source of fiber, much lower in carbohydrates than like your good old-fashioned Idaho baked potato. But when you get the sweet potato and then you put on all the brown sugar and all the mushrooms, then it sort of loses its advantage. So be careful about eating sweet potatoes, and look for other good, healthy vegetables, cooked carrots, green beans, and so on. Just be careful of all the extra stuff you put on foods. So again, managing your diabetes is not that difficult, but it does take, I tell folks, it's a daily decision making, not so much a war, but concern. And quite often it's an hourly. Do I eat this? Do I eat that? Do I sit and watch TV, or do I get up and walk around the house? Do I walk around the block? Do I exercise with my doggy or something like that? The more movement you can get your body into, more physical activity, the better off you are. So the diet and increase in physical activity are the two best ways to help try to control your diabetes. Now, of course, if you are on medication for diabetes, be sure you see your doctor and keep up with your medications, and always be aware of what's going on, how you feel, and so on, and what effect the medications are putting on you. Just because you're taking insulin or another diabetes medication doesn't mean you should go out there and start eating that whole pumpkin pie and then just take another shot of insulin to get it done. That's self-defeating. You're the only one that puts stuff in your mouth. Nobody ever ties you down, just jams a piece of pumpkin pie down your throat or a whole bag of chips and that. It's you. You make the decision what goes inside you.
Yeah. And so that's good advice for people who are living with diabetes. Now I'm going to kind of move into a little more about the eyes. So if someone has been recently diagnosed with diabetic retinopathy, do you have any advice that you would give to them?
Definitely. Try to get those A1Cs down. Again, good healthy eating, physical activity, and be sure you see a retina specialist. If they've got it diagnosed, then they're going to probably schedule you, according to how severe it is, every 6 months to maybe every 3 months. For people that have not had anything diagnosed like that, at least at 1 year, one annual retina exam with the drops in the eye and I hate this part, but let the doctor shine that humongously bright light in your eye and look all around and check everything out. But it can be controlled, again, like regular your A1C scores and so on. It can be managed. There are shots that they can get nowadays to stop the proliferation of engorged, they call them, blood vessels in the retina, and to slow things down so you can maintain your sight much better. And like other areas of the body, you might have like a pretty high A1C. There might be things going on, but diabetes is a sneaky disease because it starts doing damage and you never know what's going on is due to diabetes. You might just feel a little bit odd in your legs, and we call it neuropathy, and it affects your nerves, affects your blood vessels and things. But the higher your scores are and the longer they're up there, the more damage gets done. So the best way to combat the diabetic retinopathy or any other risks for diabetes is get those scores down, lower the amount of sugar in your blood, healthy eating, physical activity.
Perfect. Just if you could give us a few other common problems that people experience with diabetes, maybe things that you don't think about, like you just mentioned, neuropathy and pain in your legs, or are there any other symptoms that we might not associate with diabetes that are out there that people should be looking for?
A significant increase in thirst is sometimes the initial reckoning that something's not right, that I need to do something here because I can't get enough water. The thing there is that your body is trying to give you an angle, a way to flush out all that extra glucose from your blood, try to flush out through your kidneys. Trying to be aware of the feeling, especially in your feet. For neuropathy, that means there's something going on with your nerves. They're not getting nourished like they should, and they don't work as well as they should, and you lose feeling. And we've heard stories about people. The other day, somebody was telling me that they had a fella that was sitting in a chair, just kicking back, and didn't have any shoe socks on, and he didn't realize it was a cold day, had like a space heater heating up the room, and he was kicking back and he put his feet up on the space heater, never knew that it was hot because he had lost that feeling. He wound up with, I forget the entire story on that, but definitely bad, significant burns on the feet. So you need to be looking at your feet. If you have diabetes, always watch your feet. Every time you take a shower or bath, take a look at them and make sure you keep them clean and healthy, and a lot of lotion, and make sure you can feel when you're rubbing your toes and things like that. Make sure you can actually feel that.
So you're in this for a few years now. I think you all start in 2018, 19?
We got the grant late in the grant came from the Lions Club International Foundation. As a special diabetes grant that came to us and got approved in late 2018. And then we had to follow what we had budgeted and start buying up all the things we needed to have on hand to go out and do the screening. So we finally got actually in gear in early spring of 2019, and been going fairly strong, except for a year and a half, almost 2 years, getting kicked out by COVID.
Yeah. So if you can just kind of summarize kind of what overall impact that you hope to have through the Bluegrass Lions Diabetes Project, and what you've already seen during your years at work with the project.
One of the things we really try hard at doing is, once we identify individuals that have elevated A1C scores, as I mentioned before, we try to provide education at that time, at the screening event. We try to provide printed materials for them to take home and hang on to. And then we also do our best to try and get back in touch with them in about 30 days and ask them, have you seen your doctor? Did you show them the results of your screening? Have you tried to eat more healthily? Have you cut down on portion controls? And are you trying to increase your physical activity? And just let them know that we're going to follow them one more time, probably about 60, 90 days. We'll call back one more time to see if they're doing some of the things we ask them or advise them to do. Two things we have at our disposal throughout the state. not provided by our Bluegrass Lions Diabetes Project, but various health departments throughout the state and other hospitals and so on provide two main programs for dealing with diabetes. For those that are in the pre-diabetes area, they have what's called diabetes prevention program, because we don't want those scores to go up, 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 and slam into that diabetes section where you know some bad things may be starting to happen. So we want to prevent full-blown diabetes. So the diabetes prevention programs are designed to do that. One good thing, if you want to call it anything good about COVID, is that those programs used to be, you get like 6, 8, 12 people together in a room and sit around the table and talk about stuff. Then after COVID, they all went online, and most all of them are free. And it's people that are in the same boat. In other words, they all have pre-diabetes, and they're all concerned about bad things happening in their body, and they're all concerned about how it's going to affect their relationship with their children, grandchildren, and things like that. You want to see your kids grow up. You want to see your kids graduate. You want to see your kids get married. You want to see your kids, have babies and things like that. And if you don't take care of your diabetes, you literally may not be able to see all those things happening because of that diabetic retinopathy. Or if other things go wrong in your body, you might not be able to go to a graduation. You may not be able to work anymore. Millions and millions of dollars are lost due to people not being able to do the job, being on their feet. It's just too painful for so many that they can't work anymore. I think it's the last thing I heard, 1/4 of all healthcare dollars are centered around diabetes and the effects of diabetes.
Wow.
So it's very, very expensive overall, especially when you have to be zipped off to the hospital with a diabetic type of emergency. So we want people to keep those scores down and stay healthy, stay productive, have a wonderful life. It can be done.
Yeah. Well, how can people get in touch with you if they are interested in volunteering, and kind of what's involved in being a volunteer with you? I guess first of all, I mean, you don't have to be a doctor, have a history of a lot of medical school. Just tell us a little bit. You have to not be afraid of seeing a little bit of blood, but other than that, what are the requirements?
Sure. In compliance with our Lions Club International Foundation grant, we can screen individuals that are 18 years old or older, and we can use volunteers in that same age category. We've used quite a number of university students, Eastern Kentucky University, Kentucky State University, Bluegrass Technical College students, UK students in various different areas there, University of Louisville students, and the University of Louisville Lions Club's got a screening coming up November 29th, I believe it is. So you have to be of age. And then, for example, with the University of Louisville Lions Club, we're going to do a training session earlier in the day, and then a little break for everybody and grab a little lunch. And then we have the screening event that afternoon, like 1 to 3, I think it is. So a training session takes about 90 minutes. All depends upon how many people I have to work with and what their background, especially like their medical, scientific kind of backgrounds. But we go through everything that we do in a screening event. Everybody participates, and we pair up. We start talking about, okay, you're going to be the sticker, and the other one's going to be the sticky, and then you switch over and alternate on each other. But you actually go through the whole thing. And we do have people that say, yeah, I'd like to help out, but I'm not that comfortable with sticking somebody. And so, and that's fine, because we also have what we call the intake table, where they do the registration, and we have a little paper and pencil at-risk assessment that we provide. And those are things that people can do without worrying about needles and blood and so on. And we also have a resource table. I mentioned we try to provide materials to people that have elevated scores, and that's another area where somebody can work at and not have to worry about needles and blood.
All right. And if anyone is interested in either volunteering or setting up an event for you to come to provide these screenings, how do they get in touch with you?
We have a website, and it is Bluegrass Lions Diabetes Project.com.
Okay.
I didn't know how in the world to squeeze that down, or if it's just BLDP, I don't think anybody really recognize it. But, so it's the whole name, Bluegrass Lions Diabetes Project.com. My email address is pat.bldp@gmail.com. And phone number. I'm in Lexington, and it's 859-221-1041. So whichever way you want to choose, get in touch. We'll see about getting you trained if you want that, or coming to your local community and screening your people for their risk of diabetes. We've picked up quite a few companies. We've done one Amazon, UPS, 3M, and we got one coming up real soon down by London at Center. So it's a good thing for the HR people in a business to take a look at how the knowledge of how their workforce is doing with their diabetes risk would affect their business.
Yeah.
So that's a good way to go.
Yeah, very good. Well, again, thank you for being on with us today, Pat, and thank you for all that you are doing through this project and to help Kentuckians and get the word out about diabetes and provide the education that you do. So thank you very much.
I really appreciate the opportunity. Always good seeing you, Jennifer.
All right. Well, thank you. I hope everyone has enjoyed this episode of our Ask the Expert interview series. And thanks again to Lion Pat for being on with us today. Hope everyone has a good evening.